there are a couple of reasons why somebody might look into COBRA benefit.
Yep.
I never thought about that.
Yeah, for sure. So you have reduction of hours, voluntary, involuntary leaving, but you have divorce, annulment, and that also is a COBRA qualifying event.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefit systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people. Today, we're joined by Jeremy. He's a colleague of ours, and he's been working in the health insurance industry for nearly 20 years. He has served in a number of different roles across a variety of functions in the benefits industry, including customer service, implementation, account management, reimbursement, and operations, including COBRA.
Hi, Jeremy. We're lucky that you've been able to join us every season. You're always willing to share so much, and you're generous with your knowledge. So we invited you today to talk to us about COBRA, not to be confused with Cobra Kai, the fictitious dojo in the beloved Karate Kid movies. So most people recognize the Consolidated Omnibus Budget Reconciliation Act by its acronym. How did I do? COBRA.
It's great.
COBRA is a lot easier to say.
Yes.
This is coverage that allows a subscriber to keep their employer's health insurance benefit for a limited period of time after their employment ends. COBRA coverage bridges the gap between jobs. It's expensive. It's expensive because as an employee, the cost of the benefit plan is usually subsidized by the employer. So the employer might pay 70, 80, 90% of the total plan cost, and the employee's premium covers the balance. So when you sign up for COBRA, the employee is paying the full cost of the plan. Signing up is expensive, but it's pretty necessary. So we'd like to talk to you, Sensei Della Penta, about the key things a subscriber needs to know to enroll in coverage, keep their coverage, and cancel their coverage. First off, how does an employee find out that their employer offers COBRA benefits, and then how do you enroll?
Let's talk about it. It's actually interesting. So there's a couple different ways, but typically what happens is when you're first hired, and there's a couple of ways that employers go about this, but you're usually given some form of a general notice that basically says, if you're entitled to COBRA, these are all the terms and conditions as it relates to that particular continuation of coverage. A lot of ways that employers get around sending a specific general notice is they'll plop it in like their summary plan description that usually gets handed over to an employee. So that's actually already outlined in there. And really the second way that they do it is in the event there is something that happens, so your qualifying events, they're usually going to give you that information right off the bat, so you know exactly what to do and where to go with it.
That's good, because I started here 12 years ago, and if I'm expected to remember that from 12 years ago that I was going to have that benefit,
that's right.
I guarantee you I would forget, not take people up on that offer. So it's good. You find out when there's a qualifying event if the employer offers it to you.
Correct, yeah.
What do you have to do?
There's a requirement that private sector employers with more than 20 employees, along with state and local government employers, they have to provide COBRA benefits.
That's right. Yeah. And that's federal. Some states are different, but there's I think it's 40 out of 50 states offer what they call mini COBRA. Sometimes that's the buzz term. It's a state continuation coverage. It's usually like 19 and under. I think under meaning like maybe 2 employees plus up to 19. And they have mini COBRA is a little bit different, but it's still a robust offering. But federal COBRA, so speaking about the 20 plus, that is something they do have to do. So it's not really, there's not a lot of exception to that as it relates to giving out that information. Mini COBRA, there is exceptions to it, like self-funded plans, standalone dental, standalone vision. That's something that doesn't typically get wrapped into that particular benefit of continuation.
I just keep picturing snakes.
Me too. I was just going to say.
Isn't it crazy? The best thing about
COBRA.
The best thing about being in COBRA and hiring leadership is calling that person COBRA Commander. That is like literally the best thing.
I am making that my 2025 goals for my professional life. I want to be a COBRA commander.
See?
So the one thing when I was researching COBRA in order to have an intelligent conversation with you, Jeremy, is that it is more than just job loss or job transition for the subscriber or the primary employee. There are a couple of reasons why somebody might look into COBRA benefits. Yep. I never thought about that.
Yeah, for sure. So you have you have reduction of hours, voluntary, involuntary leaving, but you have divorce, annulment, domestic partnerships that get nullified, those kind of things. Unfortunately, you also have things where you have the death of the employee, so the dependents actually end up in a circumstance, or you have people that age off. So for people that are familiar with the normal, coverage terms, there's an age off point for dependents, and that also is a COBRA qualifying event.
Interesting. So how do you enroll?
There's a couple different ways depending on whether your employer does it or whether your employer chooses an administrator. So an administrator in that type of scenario, and I'll kind of lay out maybe some of the time frames here because it'll help a little bit. And it is in favor of the person that is considering becoming the qualified beneficiary as far as picking it up. So let's say you have a qualifying event. Your employer does have to send us that information, or the administrator the information within 30 days of that qualifying event. The administrator then has 14 days from that point to get the paperwork out. So your initial COBRA packet, if you will. It has all the information on it. And so typically that information is a continuation of the current plan that you're in. If it so happens it's during open enrollment, you'll actually have more options as far as what you would want to choose. Now, so you have your upfront 30 days, you have your 14 days, and now you have 60 days to choose. So, and then after you choose, depending on when that comes back, you have 45 days to make your first payment. So if you really kind of think about the strategy behind it, so let's arguably say you're going to a new employer and your insurance doesn't pick up for maybe 90 days, you have a time frame there where you may want to strategize, does it make sense for me to pick up COBRA during this time frame if I have my family, I should say, have no events that are going to cause like medical claims or anything or pharmaceuticals or whatever. If it's something that obviously you absolutely need continuation, that's something that you should act on a little bit sooner than later. But ultimately, that is how that initial process goes.
That makes sense, because if you have ongoing medical conditions or high cost medications, you might want coverage during that gap. It might actually cost you less money to pay for the plan coverage and then the copays associated with whatever the routine maintenance or medication is, instead of the variability of paying kind of out of pocket for all of those things.
Yes.
Where if you are, aside from accident and injury, if you are generally healthy and well and not on high cost medications, maybe the ROI is there to take the gamble.
That's right. The good thing about COBRA is, and I should probably say this. So let's say you make your initial payment within that additional 45 days. Your next payment, typically stating in this, is it's really due the first of the month of your coverage. However, there is a grace period. So you actually have 30 days. So for example, if your payment is due March 1st, for the month of March, and you are actually able to pay that up and through almost the end of March as far as getting your premium in. If you find out, you're really 1 month away from new coverage, then maybe you're going to get away with literally 1 month of COBRA premium, and then you cut your losses because maybe you have a $5,000 claim and your $800 COBRA premium is going to cover that.
So to keep coverage, do you just pay every month?
You do. So most carriers most administrators are actually going to either give you a coupon book, or you might have some online access that will allow you or remind you, so to speak, to make those payments. But that's it. You continually just make your payments on time moving forward. In the event you miss your payments, unfortunately, COBRA will end and you can't get back on it. So you have to remain consistent within at least that grace period to stay onto the plan.
So how long can you keep COBRA benefits?
Well, it all depends on the circumstances. So when we were talking about those qualifying events, a few of those were considered 18-month events, and some of those are considered 36-month events. For clarification, you might be able to depending on the circumstances, you can talk to your former employer, or if it's just a reduction of hours, you can talk to your current employer. But usually the ones that are a little bit longer, so the age off or the divorce or the death of an employee, those are the ones that are full 3 years, your 36 months. For the 18 months, you might be in a scenario where you go the full 18 months, but you still need some additional. And that's when, depending on your state, you might be able to get additional up to 18 months to make a total of 36 through that mini COBRA piece.
I had no idea that you could continue it that long.
You can. Yeah.
I learned something right now. I'm not going anywhere, and I'm hoping not to be going anywhere, but I'm just saying. Interesting.
So how do you cancel? So if you receive a job and you know that you've got benefits coming, how do you cancel? I want to cancel. How do you cancel?
It does depend on your administrator. And the reason I say that is sometimes they have different setups. So for example, with us, we'll take a recorded phone call or a letter or an email that basically states that I'm no longer interested in COBRA and this is my last date of coverage, something along those lines. Some administrators offer a form that you can fill out. Other administrators will actually have you go back to your former employee to have them let us know, so to speak, as a administrator, that they're no longer going to be taking the coverage. So it's generally a good idea to talk to whoever the administrator is to find out what their process is. Truth be told, once you stop making payments, eventually it's just going to close
Kicking you off
COBRA.
anyway.
No one, like, you don't go to collections. No one's sending. We'll actually send a letter, and most administrators will send a letter that states, we understand you're no longer making payments and your COBRA is closed. So I guess for the very passive version of that is to stop making payments. The most, upfront way to make sure there's no errors or hiccups and claims are paid, so on and so forth, it's to send a letter or at least an email or a phone call.
So you're not going to accidentally fall into continued coverage and get a bill that says you owe us because we continued your coverage. If you don't pay, you're off.
You are correct. Yep.
Wow, something simple in this industry. Go figure. So what if it's too expensive? What if it's just too expensive? Grocery stores these days are,
Absolutely.
large fraction of our paychecks. But no, what if you just can't afford it?
No, it's very true. The best thing that I've seen out there, and because in reality, they're relatively high priced. And I say that because it sometimes is relative to the individual. But I will say this, that usually the state marketplaces have a lot of good options. So you might have a higher deductible option if you happen to either have money aside in a reimbursement, depending on the type of reimbursement is, like a health savings account. Something along those lines is going to help offset some of those costs for the upfront deductible or whatnot. Otherwise, you could go for a little bit more rich of a benefit on the marketing, and it's still on the marketplace, I should say, and it's still maybe even more cost effective than the COBRA piece. Depending on the administrator, some might even have some suggestions for you, like based on where they're at or what their utilization is. Other ones, and realistically, it is your individual choice. You could just do your own comparison and shop. Most state marketplaces have options at various carriers where you can compare the plans, and then you can just compare it to your COBRA. And that's based on both premium and then really what's being covered and what your individual circumstance is. But I would say it is worth that just as a consumer, literally a consumer, just go out and make the choices based on all of those particular factors.
So like healthcare.gov?
Yeah, usually, some of the states have their own.
Okay.
Yeah, but yes, absolutely go through your own, your individual state marketplace. And some are, of course, are cross-state because they have national networks. So yes, you could use those sorts of resources.
Couple options.
There is absolutely a couple options.
Okay. So then you can compare the price of a marketplace plan to the COBRA, the cost of the COBRA plan, which would be the continuation of the benefits that you just currently have.
You got it. Completely.
Interesting.
Yeah.
So if you have an FSA or an HRA, does that impact affordability, or how does that affect how you pay for things?
Sure. Well, and that it's interesting. So FSAs and HRAs and even HSAs, they're really interesting as it relates to COBRA. I'll go with the lesser of all of the challenges. So HSA, because it's yours, it's an account, it travels with you. Doesn't need to be COBRA eligible to continue it. Like, it's just with you, right? So you can use that. What doesn't even matter what plan you're in the future. You may not be able to contribute to it if you're not in a high deductible plan, but you have that money set aside. Where it gets a little weird, so you have these HRAs, right? So HRAs sometimes, and most of the times I should say, is tied to a high deductible medical plan. It doesn't necessarily mean that it's going to be included in your initial premium. Sometimes the HRAs are broken out and have a completely different premium. And there's a calculation that goes along with it, which, is probably too lengthy to get into. But I will say at times it is included, but the other times it may be a separate premium that you pay to utilize the money that's in there. Sometimes if it is a separate premium and you have no money left over in your HRA, it probably doesn't make sense to pick it up, right?
Sure.
Obviously, because you're just paying for something you can't utilize. Other times there's going to be a lot of money in there that you can use in that continuation of your high deductible plan. And so it's a good idea to continue with it. So it does stay in the COBRA benefit. Other thing that is with an FSA, and this again is something that gets a little challenging, but there's what they call an unspent, sometimes call it underspent, and an overspent status. And there is another calculation that basically figures out whether or not you are in one of those statuses to make an FSA a COBRA eligible benefit. What most people do, and it's really advice, you can do it what you will with it. If you're in an underspent status and you have a big something coming up that's going to cost you a lot of money and you have a lot of money left over in the FSA, it may not be a bad idea to pay that premium for a month, utilize the FSA money to pay for whatever that service is, and then you are able to then terminate that FSA the next month. So again, you're kind of cutting your losses with it. You just may not always be in a position where you can pick up COBRA for FSA because you've already spent more than you've put into it, or so on and so forth. But good idea, again, talk to your administrator about kind of where you're at, and they would be able to help you figure out exactly what the equation is and whether you're in that underspent or overspent status. And then, of course, whatever the premium is, which is generally speaking, that premium is separate from whatever your medical plan premium is.
One last question.
Sure.
What if the COBRA subscriber becomes eligible for Medicare?
This is also an interesting one because there's two pieces to it. Sometimes the subscriber is the Medicare eligible person and the dependents are not. So what does it mean for them? So rest assured, at least where we will pause here in that sense, but rest assured the dependents can continue COBRA up to the 36 months if that's what they're in. So the dependent part, you're good. With that if you can read between the lines, typically what that means is you're not going to have COBRA when you're Medicare eligible, because what ends up happening is if you don't choose Medicare B within time, there's like this lifelong delayed penalty, so to speak, that's built into the premium. So most people will pick up Part B right off the bat when you're eligible, which then makes you discontinued on the COBRA benefit itself. Now, I should qualify that with sometimes you can still have COBRA for like a standalone dental or a standalone vision. So you kind of can continue with COBRA on a separate vision and a separate benefit. But for the medical portion of it, once you're Medicare eligible, the COBRA is basically going to end.
Because it's essentially a different benefit plan.
That's correct.
So you wouldn't continue the plan you're on. You're just changing benefit plans over to that Medicare plan. Yeah. And that's a whole different conversation that I can't even touch because those government plans break my brain.
They break everyone's brain. This is why they usually outsource them. But yes.
Yes. There's a lot to know. But this is super helpful to understand about COBRA because you don't want to need it, but there could certainly be circumstances where it could be really helpful. And it's kind of that bridge in between the next phase of your life, whatever that is.
That's right.
So thank you for spending time with us and kind of getting into these details. And it's not an exciting conversation, but it's one of those things where when you need it and you need to understand it, it can feel overwhelming. So I think this is a quick way to get to the bottom of things real fast.
Yeah, it's my pleasure.
Thank
Jeremy.
you.
You're welcome. Thank you.
This podcast is brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.